Thank you, Suzette. A little bit taller. Well, can you hear me okay, or should I hold it? Hold it, okay. Well, I know I stand between you all and door prizes at the end of the day, and some ducks from what I hear. But I'm happy to be here today to present on reducing dementia risk, maintaining a healthy brain. This is a dementia caregiver conference, and you are caring for people with dementia, but how many of you are concerned about getting dementia yourself? Right, okay. So a lot of times I hear, well, there's nothing I can do, I'm gonna get it or I'm not, and you feel out of control and a little defeatist, but there is a whole bunch of research on an international level showing that there are things you can do that significantly reduce your risk of dementia, and especially if you have a family history, it may have some genetics that increase your risk. Trying to control the things you can is really important. Are the slides going to change on these screens as well? Just the middle, okay. I feel like I'm standing right in the way then. So that's what we're going to talk about today. I'm going to talk about the power of dementia prevention, prevention across the life course, modifiable risk factors, so things we can change versus things we can't. And then if we have time, about some of the public health initiatives in the U.S. that are promoting dementia prevention programs and education. Okay, so in a world where things feel uncontrollable, and as dementia caregivers, it's easy to feel out of control, there are things you can do that help reduce your risk of dementia. And as Dr. Blanche mentioned earlier, dementia is a public health crisis, not only in the United States, but around the world. And you can see here that currently about 7 million Americans have Alzheimer's or another type of dementia, but that's going to increase to close to 13 million if we are unable to significantly delay or cure Alzheimer's. And it's already a very expensive disease, and it's only going to increase to $1 trillion. So there are a lot of initiatives out there that are trying to get people to adopt healthy lifestyles that help reduce your risk so we can drive down these dementia numbers. And lots of great therapeutic drugs in the pipeline, and some that are released that are helping slow the disease. So there's a lot of hope in dementia right now. So what I'm going to talk about is based on this report, the Lancet report that came out in 2020. This was a group of international dementia experts who did a massive search of all of the different research studies around the world related to modifiable risk factors, which means things you can change. So some things we can't change are, for example, age is the #1 risk factor for dementia, right? Someone can cure aging. You're onto a miracle drug. But, so there's some things we can't change, but there are things that we can. And the goal of this consensus article was to create a list of recommendations that are evidence-based, so based on clinical trials, research trials, really meticulous research studies on how to reduce dementia risk. And what they found is, looking at all the different studies around the world, there are 12 factors that prevent or delay up to 40% of dementias worldwide if people make all of these changes in their life. So 40% we could reduce dementia by if we can change these things. But we know that changing habits can be hard. But maybe there's one that I'll talk about today that you could work on changing. So in this article, they looked at studies across the lifespan. It's a little hard to see, but the green is early life, then the blue are factors in midlife, and purple are later life factors. That's not to say that you should smoke like a chimney till you're 80 and then quit. So these lifestyle changes apply to your whole lifespan, but the studies that they're reviewing took place in these age groups. So these are the different factors we're going to go through, and this is very informal. Please raise your hand, ask questions as we go through. So early life, the number one thing we can do, and they define early life as less than 45, so I'm still there, still in the early life phase. But the biggest thing we can do across the lifespan is education, right? So they found that higher levels of education in childhood and educational attainment across the life course reduce dementia risk. So obviously with children, early education is very important, and going to college, continuing to learn, but it doesn't have to be formal education in a school setting. The biggest thing is to keep exercising your brain. Have you ever heard use it or lose it? Right? The brain is a muscle, so you got to keep it active and engaged. And the most helpful activities are those that involve problem solving. But some examples of things that are challenging or novel to your brain are travel, learning a second language, playing games like Scrabble or cards, playing music, learning an instrument, creating art, reading. All of these things help exercise our brain and form more connections between our neurons in our brain, which help us combat the Alzheimer's and other dementia pathologies in the brain. Does anyone have examples of something they're doing novel to exercise their brain? Yeah.
Writing a book.
Oh, well, there we go. Writing a book. That is quite the endeavor. Yes, that's challenging.
Too complicated to go into.
I'm using Duolingo to learn Spanish. So that's been a good brain exercise. Anyone else have anything, new hobby they started? Well, think about something you could do that's fun. Jewish Family Services offers art programs, a lot of creative music and art programs, so check out their table. So that's the biggest one for early life. Midlife, 45 to 65, these are the research studies that were done. And one of the biggest factors in midlife is hearing loss. You wouldn't think that has to do with dementia, but in the report, they found that cognition or thinking skills decreases for every 10 decibel reduction in hearing loss. So even if you still fall in the normal range and it's not clinically diagnosed as hearing loss, that still impacts your cognitive functioning. And hearing aid use protects against cognitive decline. And you can see, it's a little hard to see here, but if you have mild hearing loss, your risk of dementia doubles. Moderate, it's 3 times greater. Severe, 5 times greater. Why do you think hearing loss is related to dementia risk? What happens when you have hearing loss?
You miss part of the conversation.
You miss a conversation, so you're going to socially withdraw, right, and isolate yourself, which we know from Dr. Cipriano, and I'll talk about later, is a risk factor. Yeah, so that's the biggest issue, is that you're withdrawing and you may become depressed, you may become isolated, it leads to other health issues. But the good news is, if you can get hearing aids and afford hearing aids or have insurance that covers it, this is a reversible risk. So for those of you who may have family members who are like, oh, they're ugly, or I don't want one, just tell them you're reducing your dementia risk if you get a hearing aid. Forget about your vanity, save your brain. And then traumatic brain injury, also known as TBI. These are injuries to your brain. They can be mild, where you fall when you're skiing, you see stars, you get a little concussion, or more severe, where you actually have bleeding in your brain, you fracture your skull, you have brain swelling or edema. And this is especially dangerous for people age 50 and older. If you have a TBI, and it depends on the severity of the TBI, your risk of dementia increases significantly in the 6 to 12 months following that injury. And there's a bunch of different ways we can injure our brains. Wear your helmets, your seatbelts. But for older adults, falls especially are harmful for our health in general, but especially for your brain if you fall and hit your head. So taking fall prevention measures, getting rid of the things in your house that you could trip on, area rugs, doing exercises that increase your strength. Anything you can do to prevent falls is very helpful. And then hypertension or high blood pressure. Persistent midlife high blood pressure is related to an increased risk of dementia in late life. And there's been a lot of research studies on this recently. About 10 years ago, the standard treatment was to get your systolic, or the upper number, below 140. That was the goal. And then they did trials looking at getting it below 130. And every time they lowered it, dementia risk went down and cognitive functioning went up. So the most recent trial is called the Sprint Mind trial, and they found a huge result. They actually stopped the trial because the effects were so great between the placebo or control group and the treatment arm. They stopped it and said everyone needs to go on the treatment arm because it reduced dementia risk that significantly. And they did find in a variety of studies, it doesn't matter, there's a plethora of hypertension medications. It doesn't matter which one you're on or which type. As long as you can control your blood pressure, that will reduce your risk significantly. So again, if you have people in your life who are resistant to medication, tell them it'll help their brain and reduce their risk of dementia. And this is risk of any type of dementia, not just Alzheimer's, vascular dementia, Lewy body dementia, any type of dementia. Okay, alcohol use. This was a new factor from the original 2017 report. They didn't include this, but more research has come out showing, not a surprise, moderation is key. So heavy alcohol consumption or having a substance abuse disorder is related to cognitive impairment as well as dementia risk and dementia at earlier ages, so younger ages. And that is defined in these research studies as more than 21 units per week, which I'll talk about in a second. Light to moderate drinking compared to not drinking at all is actually related to a decreased risk of dementia. And studies define light to moderate in kind of a variety of ways. Some of the studies said 12 units, some said 14, and most of them said less than 21 units of alcohol. So what is a unit? It's a metric system, but in general, if you think of a week, 21 units, if you have a decent sized glass of Chardonnay, that's about 3 units. So a whole bottle of wine is about 10 units, 9 or 10 units. If you like your Jim Beam, a shot of that is 1 unit. So just watching how much alcohol you're consuming is important. And then, why do you think maybe light to moderate drinking reduces your risk compared to not drinking at all? What are most people doing when they're drinking? Relaxing and socializing, right? So a lot of these risk factors interact with each other. So if you are an imbiber, just make sure it's light to moderate. Obesity, not a surprising modifiable risk factor. So obesity is related to increased dementia risk, and that's also related to other health conditions that go along with obesity, like diabetes, cardiovascular disease. Losing weight, in one study, found that every 4 pounds that you lost, you improved memory and attention if you were overweight or obese. Now, what is obese? That's having a body mass index greater than 30. Overweight is 25 to 30. And if you just Google body mass index or you go to the doctor, it's dividing your height by your weight and coming up with that number. And you can see there's a variety of different classes. There's underweight, normal, overweight. Obesity now has 3 different categories of mild, moderate, and severe obesity. So if you can, just try to work on losing a few pounds at a time if you and your healthcare provider decide that that is something you should do. Okay, so those were the studies done in midlife. Late life, you may say, oh, I'm 70, it's too late, I can't change anything. Not true. You can still change and reduce your risk. If you are a smoker or a vapor or anything with tobacco, try to quit if you can, because smokers are at higher risk of dementia than non-smokers. However, they also tend to die more prematurely due to smoking-related diseases, so before they actually get dementia. So you don't want to die or get dementia, so try to consider quitting. Secondhand smoke is also not good for memory and attention. So if you're in the household with someone that smokes, try to get them to go outside, open windows, limit that. And even if you wait to midlife to quit, and you quit for at least 4 years, for the next 8 years you had a significantly reduced risk of dementia. So even if it's later in life, it's not too late to reduce your risk of dementia. Depression is a little bit of a chicken and an egg situation. Depression is related to increased dementia, but it's also a symptom of dementia. So depending when the dementia starts and the age of onset, it may be a symptom of dementia or not. There's a variety of psychological and physiological causes. Late life depression increases dementia risk. So if someone's never had depression and they get diagnosed with depression at 68, that could be a sign that it's actually changes in the brain related to dementia causing the depression. So if you see someone in your family who's always been pretty steady and then they suddenly are starting to get depressed, get them into the doctor and get that assessed. As far as medication treatments, there are some studies in animal models showing that certain medications like Celexa or citalopram actually helps the brain. I won't go into the biology of it, but it helps slow down some of the changes in the brain related to dementia and delayed progression from mild cognitive impairment to Alzheimer's disease. Again, that's in animal models still. More research to come on that one. Okay, it seems like the message of the day is don't socially isolate yourself. Research has shown that less social contact increases the risk of dementia. Right? We're not exercising our brain when we're not engaging. It can lead to depression, poor lifestyle habits. So stay active, stay social. Someone I heard recently say, just show up. If you don't feel like it, just do it. Just show up. And we'll talk about that a little bit later. But married adults, especially in the older generations, tend to have a lower risk of dementia because they have that social interaction, and usually social circles were mainly limited to the marriage. High social contact is related to better late life function. Interestingly, loneliness was not related to dementia risk, but lack of social interaction was. And it's the same for men and women. There was no difference in risk based on social isolation. Okay, we all know this one, right? Physical activity, exercise is associated with reduced dementia risk. There is a lot of variety in research studies about exercise, but in general, this consensus group said at least weekly moderate to vigorous exercise will reduce your risk. And what does moderate to vigorous mean? You're breaking a sweat, whether that's raking, whether it's walking around the block, going to an aerobics class. You want to get your heart rate up. So slight improvement in cognitive functioning in normal adults and those with mild cognitive impairment were found in interventions where they were assigned to a walking group or a group that just got information about walking. So even in those of us who are cognitively normal, exercise still helps your thinking skills. And they found that vigorous resistance or weight exercise, aerobic exercise is best. Yoga doesn't seem to do anything, which is a bummer because I like yoga. But you want to, again, get your heart rate up. Vigorous exercise. Doesn't mean you need to run a marathon, doesn't mean you need to exercise an hour a day, but just try to be as active as you can during the week. This one is not great for those of us, all of us here in Utah. The new factor that they added in the 2020 report is exposure to air pollution increases your risk of dementia, specifically high nitrogen dioxide concentration and fine ambient particulate matter. Check your weather app at the bottom, it'll tell you what the air quality is. But here in Utah, because we're in the valley, we get those winter inversions. Please, if it says unhealthy, don't go out and run. I see the people out, it's a red day, you can't see 20 feet in front of you, and people are out running or riding their bikes. Don't do that. Go inside to a gym where there's air filters. These are caused by car exhaust, coal, and gas-fired power plants, fires, smoking. Gas stoves in your house can release these chemicals, construction sites. So some of this we can avoid, some we can. If you're thinking about getting a new car and we're debating about getting an electric one, you might want to consider electric, help our air. Diabetes. Type 2 diabetes is related to an increased risk of dementia. This risk increases depending on the severity and duration of your diabetes. And they're studying different types of medication, whether insulin or metformin or other medications help reduce risk. They're still looking at that. But unlike blood pressure, where they had greater effect the more controlled your blood pressure got, there's no difference in whether you have really strictly controlled blood sugar versus, standard treatment. So if you have diabetes, make sure you're checking it, you're regulating it, so you can reduce your risk of dementia. So how do these things change? So these top box here, what's the mechanism? How is this preventing dementia? With head injury, smoking, blood pressure, it's reducing the neuropathological damage or damage to the neurons and systems in your brain, which are related to dementia. And then these other factors help increase cognitive reserve. So cognitive reserve is building up the networks in your brain to make them strong and well connected, even growing new neurons, new connections. So the more reserve you have, think about the more muscle you have. If you were to get sick or have some injury, you would have some reserve to fight that injury off. So that's the thought behind it. Is if you're exercising your brain, you're strengthening your brain. If you do have some plaques and tangles, you won't show symptoms as early as someone who doesn't have that reserve. And all these factors work together to lower your risk of dementia. So what can you do now? I know it's overwhelming. There's probably lots of things you're like, oh, I do that, I need to change that. But baby steps is always what I recommend. If you want to add a cup of fruit to your daily diet, or you say you're going to walk just around the block 3 times a week, everyone texts and emails these days, but pick up the phone and actually talk to someone. Call a friend, call a family member, meet for coffee or lunch. Get a hearing exam if you're having trouble hearing. Buy a puzzle. Sudoku, crossword puzzles, actual puzzles. Just try to make those baby steps as opposed to trying to do extreme changes in your life. And then one initiative that's going on in the U.S. is called the BOLD Act. This passed in 2018. It's basically a dementia education, awareness, and prevention program. It's supposed to be renewed this year. Some of us from the Alzheimer's Association actually went to Capitol Hill a few weeks ago to advocate for increased funding for this, but dementia is getting more and more attention. There's more research funding, there's more education, more awareness, and it brings hope. So those are some things that I wanted to talk to you about for reducing your risk, and I'm happy to take questions. Yeah.
You didn't mention sleep. Like, does sleep have impact?
Yes, it does. So it was in the report, but there weren't enough randomized clinical trials to count it as a factor. But sleep is very important because as we sleep, it's kind of like the garbage truck comes and clears out all the toxins in our brain and amyloid and factors that increase our risk of dementia. So sleep is very important. If you have sleep apnea, make sure you get it treated, wear your CPAP. If If you have insomnia, go to the doctor, because that's when our brain cleans out the garbage that leads to dementia. So sleep is very important. And you're probably like, why wasn't diet on there? But there's so much variation in diet, and you can't really randomly control one group to only eat X, Y, and Z for 10 years and another group to eat something else. So there wasn't enough rigorous data, but in general, the Mediterranean diet has been found to be really healthy and protective against diabetes and heart disease, both of which increase your risk for dementia. So eating healthy is never a bad idea. Yeah,
You mentioned testing for Alzheimer's. You mentioned Celexa,
yeah.
the drug. Is that, what kind of a possibility is that? Is that something you could use to decide whether you have the propensity to have any type of dementia?
Okay, so the question was, and I think it's two factors. How do you test to see if you have risk factors for dementia? And then Celexa is a SSRI, or selective serotonin reuptake inhibitor. It's a medication to treat depression. And that was one study done in animal models. They haven't done human trials of what reduces dementia risk. But as far as there are more even blood tests coming out to determine your risk for dementia, 23andMe is just an over the counter. It's anyone can do 23andMe, and I'll tell you if you have some genes that increase your risk for dementia. But historically, doctors haven't been doing that testing because there's nothing we can do about it. However, now there actually are some medications coming out that alter the disease. So I think there'll be more testing now that we actually have treatments. But you can talk to your doctor about that. Yeah.
Why are we seeing such an increase in the numbers? Like, from 5 million to 7 million, is it just because we have an older population?
Yep.
Or is there something else?
Good question. So why are we seeing such an increase in dementia? The main reason is that we're living longer, right? So 100 years ago, the average lifespan was like 58, right? You weren't getting old enough to get dementia. But with medical interventions and lifestyle changes and technology, our average lifespan just climbs higher and higher, and with each 5 years, the risk of dementia doubles. So that's the main reason why we're seeing more numbers. And some of it is just more awareness. People know what it is now, they're going to their doctor, they're getting a diagnosis. So where before it was just hardening of the arteries or senility, and they didn't go to the doctor, didn't do anything about it. So I think some of it's just increased diagnosis too.
And what was your 12th factor? I have 11 for diabetes, but there were 12 factors that
Ooh.
decreased dementia.
Let's go back to, sorry to make you dizzy here. Okay, so we got education, hearing loss, traumatic brain injury, hypertension, alcohol, obesity, smoking, depression, isolation, physical inactivity, air pollution, and diabetes, which should be 12.
Yes.
Other questions? Yeah.
Hi, Kara. This isn't a question, it's just a comment. In fact, two comments. One was in addition to what you said about why are there so many more cases. There are definitely several reasons. And one of those is that years and years ago, when I was in medical school, everybody who got dementia in older age had senile dementia. That's no longer even a diagnostic category. So a lot of those people had Alzheimer's, and we just didn't recognize it. The second comment concerns testing and treatment. Right now, every time we get a new monoclonal antibody treatment for Alzheimer's, it becomes more and more apparent that early diagnosis is going to be critical in treatment. Whether it ends up being an mRNA vaccine or a monoclonal antibody, it's probably going to be one of those two. And so what we're seeing, and this is worth watching in the media, is blood markers. And one of the biggest forces for blood marker is coming out of Provo. And so watch closely, because as soon as we have a really good blood test for Alzheimer's, you can make that diagnosis well before any symptoms show up. And then the monoclonal antibodies might be helpful.
Yeah, excellent point. Dr. Blanche mentioned now there's actually medications that reduce the number of plaques in your brain and slow the disease process, but the FDA criteria is that you have to be in the mild stage, and so you need to get it assessed and diagnosed early to be able to qualify for the treatment. So another reason, if you have someone who's hesitant to go to the doctor, say, hey, we might be able to get you on medication, but we got to go sooner rather than later, because once you're in the moderate stage, you're ineligible. Yeah.
My husband and I looked into the drug that was approved last July. And the neurologist who was stepping in for ours, the first thing she said to us when she talked to us was, I wouldn't give the drug to my family member. And that efficacy rate of it doesn't outweigh the risk of a bleed in your head.
Yes, so depending what healthcare provider you talk to, it's a little controversial on whether they would recommend it or not. I've heard the opposite, where a neurologist said I would give this to my mom. There are risks involved, especially if you have the ApoE gene number 4, which increases your risk for dementia. You have increased risk of ARIAs or bleeds in the brain from the medication. So there are a lot of different criteria that you got to factor in. As well as it's an infusion, so you have to come in to a medical center every few weeks. It may not be possible for someone who's out in Delta. So there's a lot of factors that go into it about whether it's the right drug for you. But there are concerns and side effects. Yeah.
Just take a quick rebuttal to that, and I agree. But every time we see a new drug, and it's expensive to develop these things, takes a long time, but every new drug is a step in the right direction. And the latest drug that has not yet been approved by the FDA, again, monoclonal antibody, in some of the patients, they cleared every single plaque in the brain and were actually able to stop the infusions. So, there's hope.
There's great hope.
Not for anybody in this room, sorry to tell you that.
No, but it's true. Like even though, as Dr. Blanche was saying, with some of the treatments, once your amyloid plaque levels get low enough, you stop. You don't have to take it forever or the rest of your life. And the efficacy, risks and benefits, but the trials showed that it can delay disease 5 years. And 5 years is a long time. That's 5 more years to play with your grandkids, 5 more years to be engaged or out of long-term care. So it is something to definitely consider.
And it's just the beginning.
Just the beginning. There is a whole pipeline of medications coming out. So I used to say this, I hope there's a cure in my lifetime, but now I'm very confident that there will be a cure in my lifetime. Yeah.
Going back and talking about, early detection and trying to get that going like there is history in my family. Where do you decide, hey, I need to start getting this type of testing or that type of testing to understand, where am I, on that path if it is going to be coming?
Yes, that's a great question. When do you get tested? If you have a family history of dementia, your risk is higher than someone who doesn't have a family history. So right there, you already know you're starting out a little bit higher. Usually by the time someone notices changes in their memory, the pathological process has already started, even if they don't qualify for a diagnosis of mild cognitive impairment or dementia, there's changes going on. But I think the earlier you can find out, the better, just because the other reason to go to the doctor in terms of diagnosis is there are a lot of other things that cause memory and attention issues, right? If mom is suddenly getting lost driving to the grocery store, she could have a UTI, she could have medication interactions, she could have a low vitamin B12. My dad, I was very convinced he had dementia. He wasn't making sense. Went to his primary care doctor, and his glucose was 500. He had undiagnosed diabetes, and as soon as he got that treated, his cognition went back to normal, and he, was doing fine. So there's a lot of other reasons to go to the doctor to get memory changes checked out, because it may not just be related to dementia. But there's a lot of ethical concerns with the blood tests and biomarkers, because if you find out at 30 that you're at risk for dementia, you know, what do you do about it? And finding out too early sometimes is not beneficial and can be anxiety provoking. So it's going to be a lot of debate as these medical advances continue.
But we're hoping, Kara, that someday there will be a blood test that tells you that you have it, not that you're at risk for it. So every year you go to your doctor, he does a complete metabolic panel, a CBC, and an Alzheimer's test. And so it doesn't, eventually it will test, it will actually tell you you have it, whether, not just a propensity for it. And that's when, once you're positive there, then you start treatment and you never get symptoms.
Yes.
That's the hope.
That would be the hope, right? Yes, is to find out that you already have it. Because these plaques and tangles that cause Alzheimer's specifically, they start in your brain about 20 to even 30 years before you have symptoms. So all of us in this room could have some plaques and tangles. We're not showing symptoms because we have good cognitive reserve and there's not enough in our brain. But their changes happen, it doesn't happen over a few years. It's decades of these changes. So the earlier we can diagnose this and treat it and intervene, the better. Other questions? Everyone thought of one little thing in their life they could take a baby step on to help reduce your risk? Maybe?
Do I have to give up McDonald's French fries?
Well, no, McDonald's French fries are delicious. Just don't eat them every day. Yeah.
I'll say that I know a lady who's, I think she taught school up till she was 93. And I know her through the figure skating world, and she's still a judge at 93. And somebody was asking her, and I'm sure it's a lot more complicated than this, but one thing that she said about why she's still up and running is that she said, I take a different route home from my work or wherever every day. So she chooses to do something that challenges her brain.
Yeah, that's very important. Even as simple as if you brush your teeth with your non-dominant hand, or go to a different grocery store where you don't know where everything is. Just constantly challenging your brain is probably one of the best things you can do. And just makes for a more fun life, right? All right, well, I think we're ready for some raffle drawings. So thank you all.